Oh, yes. And you know you're in a fabulous breakout room when a Window Between Worlds founder is in the space. Thank you, Kathy. Woo! We just celebrated our 35th anniversary. So you all are in great hands. Yes, it just goes to show you be bold with your vision. Kathy thought starting Windows was just a crazy idea 35 years ago, and it is the reason we are all here today. Woo! Awesome. All right. Well, I think we can go ahead and get started. It is my pleasure and privilege to introduce Ellen to the space. She's going to be sharing with us today. She is a clinical social worker and a behavioral health specialist who next month will be sharing or next month we'll be celebrating 4 years of being an active Windows facilitator and 5 years at A Greater Hope. She's got a master's degree in psychology and uses the windows in so many different settings, individual, in groups. And what she shared, which is so beautiful, and it's been alluded to already, what she finds is that when the words can't convey what we've been through, and also from what we know about neurobiology and trauma, we literally can't get the words, the art speaks. And you all might be thinking, oh, well, she's been doing this work for well before she started at A Greater Hope 5 years ago. Actually, she was for most of her career, she worked in retail. And what she realized was that it really worked against her morals because she recognized that she was trying to convince people to buy expensive things they didn't need. And she wanted to work more in alignment with her values. And she shared that while doing the work, serving folks at A Greater Hope, working with individuals involved in the foster care system is heavy work. It is so rewarding. And at the end of the day, she knows that she has made a positive difference in someone's life rather than just pushing consumerism. Hello, fabulous.
Thank you so much, Christy.
Absolutely. Thank you, Ellen. We are grateful to have
If
you.
you had told me when I was 30 years old I'd be doing this at 72 years old, I'd have said you were insane. But here I am, still working my butt off, and at this age when I should be retired, I don't ever plan to retire, by the way. I love this work. I do. It is so hard some days, and some days I cry so much. It is just, I don't think I'm going to be able to do another day of it. But honestly, I go to bed at night and I go, wow, okay, that was a 12-hour day that really wore me out. And right now, I'm feeling pretty darn good about it. So this job really does align with my moral compass. And I know that this organization is really big on the whole moral compass thing. I love A Window Between Worlds for that. They're fabulous people. I love the program. I love the materials, and it's been really, really influential on my work in foster care system.
Thank you, Ellen. Yes, let's get into it. I love it. We're already getting started, which is fabulous. So, the way that this will be structured is I've got some questions for Ellen, and while she's sharing, invite you to think about, I wonder if I have a question I'd like to ask, because after I've asked some questions, then Ellen's going to pop in and invite anybody who would like to share any questions. So, welcome you to begin thinking about what that might be. And Ellen, you were already starting with our fabulous first topic around, tell us about how you first started using art and getting connected to A Window Between Worlds.
Honestly, I had never heard of this organization until I went to work for A Greater Hope. And our CEO, Helena, and your sister, Amanda, who works at our organization, they told us there were some scholarships available and they were doing new facilitator training. And, I looked at the training information and it was kind of pricey, and I mean, I don't mind investing in myself. I love education. I'd be taking my third PhD program right now if I could afford it. But, I thought, I can't really swing that right now. So they said, no, there's scholarships, apply for a scholarship. I thought, okay, I'll apply. And fortunately, I was given a scholarship and I got to go to the in-person event in September of 22. And it was at this fabulous location with this fabulous staff of people that just rocked my world. I mean, it was so impressive. The kindness and the compassion And the way they showed how art could be used in a way I had never really thought about art. I mean, I was always under the pressure to do a certain project a certain way and follow instructions. And this is, we give you some guidelines here, we give you some ideas here, and then you take it wherever you want. Do whatever you want with it. There's no right or wrong way. I love that. There's no right or wrong way. And I just learned in that weekend, I learned so much about what I thought art was versus what art can be, that healing power of art, and so much about myself. And I use a window between worlds to kind of keep myself grounded as well. Because as you said, this is a very heavy, stressful occupation. It can become overwhelming for us as staff members sometimes too. You feel like, I can't do this one more day. I need to call out sick. I need a day off. I need a break from this. But you have to keep going because your clients are depending on you. And so I use a lot of these exercises myself just to active activity before bed, to calm me down. And it's been so beneficial. I love what it does for my kids. I love what it does for the parents, and I love what it can do for us ourselves. It's really important to do some self-care too.
So important. And funny how that falls off the radar. Yes.
Uh,
Thank you. Thank you, D. Ellen. Yes. Looking more at that idea of the different ways that you've used the art, I'm curious if you could share about if there was a specific need or maybe a time when you used art with a bio parent where you saw it really met a need in that moment and had a positive impact on that bio parent.
Well, as most of you with the window between worlds know, my favorite exercise, which is in this toolkit, is the container of overwhelming feelings. When I discovered that workshop, it is so universal in so many settings where you meet somebody in crises who literally cannot express themselves. They can't get words out because they're so choked up with either rage or embarrassment or insecurity or just so many feelings, and biological parents, especially. I mean, let's face it, your children have just been taken from you. You are feeling very judged. You are feeling like the biggest disaster in the world. And oftentimes, and I know this from my own experience because I will share with you, we were working on this program 2 years in the works here for this compass to come out. And my own grandchildren were put into foster care. Yeah. And it was not a big, like horrible abuse. It was a simple, stupid mistake that my daughter-in-law had made, and a neighbor called the cops, and they ended up going into foster care. Anyway, it was a very emotional time for me. And when my son came up here to see me and let me know that the girls were in care, this is a boy, I had not seen him cry since he was 2 years old. And he stood over my kitchen sink and he broke down in tears, heaving over the sink because he didn't know what to do now, and he's up here asking me for advice because you work in the field, Mom, and you should know, and how am I going to get these girls back? And I'm trying so hard to be his mom and yet let him know how this process works and that it's going to be a process. This is not going to happen overnight. Once they're in the system, they don't just go, oh, yeah, we made a mistake. You're right. You should get them back. No, it's, and I happen to have my laptop bag downstairs with me when he came over, and I got those little worksheets out, and he just was sobbing and he couldn't talk. And we just sat there and we just colored together. I didn't even explain the exercise. We just kind of sat there and colored together. And I've done that same thing with some of my biological parents. In this field, the first time we usually meet the biological parents is when we do an intake. And intakes are difficult because it's a long, involved process with a lot of paperwork that asks kind of personal questions. And they're already, on the defensive. You've got my kids and I don't think this is right. And they can be confrontational. They can be really angry. They can be just overwhelmed with sadness and sorrow, and they can't talk. And I had one mother, she had five little ones from a newborn up to 10 years old. Um, she was visibly shaking when she came to the office. We'd already tried to do intakes by Zoom several times. She couldn't figure out how to get on Zoom. So I told her, I will meet you at the office so we can do this. And she came in and I had everything set up for her and she couldn't talk. She was shaking. And I just pulled out my favorite worksheet and I always have color pencils and sharpeners with me and we're ready to go. And she sat there and again, I didn't explain it to her. I said, let's just sit here a little minute. Let's have a little minute and we're just gonna look at this color, whatever comes to mind. And it just that activity of putting the pencil to paper calms the nervous system, gets you to where you can actually take a breath. Because, when you're really upset, how you just stop breathing, you hold your breath. I mean, I do it myself when I'm nervous. I can't breathe, I can't breathe, I won't. But so she calmed down. We got through the intake. And at the end of it all, when we were all done, and we were there for a long time, she said afterwards, she goes, "Can I give you a hug?" And I said, "You know what? I do not ever turn down hugs. You bring it on, girl." And we had a nice big hug. And her reunification plan has not gone, the way we would like to see it because she struggles with drug addiction and has been in and out of rehab many, many times during the years that I've been assigned to these children. But she still calls me to let me know how she's doing. She still calls me and go, "Yeah, I'm back in rehab again. I'm trying to get it together." And that's, it's a real struggle. And these bio parents, a lot of times they have so many hurdles to jump
Yeah.
on that long road to reunification. And no education, no job skills, drug addiction, no support system, no money, no housing. So, they're fighting against so much. And it's such a long and painful journey for them. And I'm so glad we can use this art with them to help make that road a little smoother. It does really help.
Thank you, D. Ellen. Oh, incredible. Incredible. I love how you touched on that it's having colored pencils and that paper just on hand because we have these preconceived notions of, oh, I've got to have all these supplies and I've got to do all this. So thinking about if you were going to give a tip to all of us in this space or that are maybe thinking about or already using art with those that we serve, what would your tip be to support us with using art, whether it be with biological parents and beyond?
Yeah, I don't think it matters who you're working with. Part of what I learned being trained as a facilitator with the Window Between Worlds is that you're going to take what they give you, which I used to read verbatim and get those materials and plan for that much time for this activity and that activity and that activity. And you're going to learn to make it your own. And you're going to learn to read the room, depending on who you're working with. So, for instance, I plan a workshop for teens. And I'm planning on this Riverstone activity where I'm going to play this calming music and we're going to journey down this beautiful, smooth river and explore all the different changes that took place in our life. And I'm going to play this calming river nature sound music. And I've got it all set up and it's beautiful. And I've got photo ops and I've got the going with it food and I've got the lighting and everything going for it. And the kids are looking at me like, what kind of music is this? Change it up, change it up. Be responsive to what their needs are and what feedback you're getting from them. And if they want hip hop, if they want rock and roll music, put it on. Let them journey down their river to that horrible stuff. It's okay because they're going to be more involved in it. They're going to be more they're going to have that buy-in to really stay there and complete this project for the next hour or so instead of getting up and taking a hike out to the parking lot. So learn to read your room and make it fun for them. We do give that opportunity with these worksheets to explore some really big and deep feelings, which again can bring up a lot of tears and a lot of other emotions and can be a little hard to handle. So be able to have people have a space to go take a little break or to, change it up for them where you see the needs so that they are a little more inclined to stay and have that commitment to see it through and finish the project.
Beautiful. Talk about authentic and responsive facilitation right there, Deellen. Beautiful. Beautiful. All right. Thank you so much.
You're
And
very welcome.
now we'll transition. We want to give an opportunity for anyone in this space who would like to put forward a question. We'll likely have time for just a few, but do know that if you have a question and we are unable to answer it during this time, I'm going to put a link in the chat to our info at. You're always welcome to reach out, and just welcome if anybody has a question they'd like for Deellen about what she shared, anything beyond, welcome you to raise up your virtual hand or your actual hand, and or put in the chat I would like to share, and we'll welcome you to come off mute.
I'm only good with actual hands. Actual hands are good.
I know it's funny that that's odd when we raise an actual hand in a meeting.
But I would still like to use actual paper and pen too. Yes, Liz.
Oh no, I was saying because we don't know where to put it. It's weird because the camera lens. Well, I mean, I'll just share. I'm really excited that this opportunity has come to us through A Window Between Worlds. I started with the program in around 2006, and I was in Colorado. So I was working for a victim assistance agency and got started with my boss let me do it. And so I've had an opportunity to do it in all kinds of different places. Then moved to Branson, Missouri, and didn't have an opportunity to work for a domestic violence shelter or anything, but I started doing supervised visits and parent education with an LLC. I was contracted, and just decided I'd start using some of the art workshops with my families. One was a homeless mom and 5 kids and four pregnant. So I'm just sharing it. I'm just amazed because I'm so happy you guys are doing this because it's different. It's not just domestic violence victims now. Now you're actually talking about biological families and the kinship families, but now I'm in Kansas City. So I'm trying to get on with a domestic violence agency here that I think looks really promising. So I'll be sure and be using the workshops.
Absolutely. Thank you so much.
Yeah.
Liz, you're a beautiful example of, yes, Kathy's our founder, but she often talks about how Windows is a co-creation and we're all founders, innovating the program and taking it to new spaces. And I mean, heck, 10 years ago, that's our almost 20 years ago, because you said 2006, is that right?
Yeah.
Almost 20 years. That's amazing. Thank you, Liz. Thank you for taking us to new places and new people. It's wonderful to connect.
Thank you.
And Jessie, I see your hand up. Thank you.
Yes, I raised my virtual hand. I see a couple of my other fellow Greater Hope folks in this room who also work with biological parents. And Deellen, I wondered if you might share a little bit about like the inspiration from working in foster care to then working with the parents doing this art. What does that do for the children while they're sitting there with their parents, whether it's their biological parent or whether it's their foster or kinship parent? Could you explain like a little bit just what you've seen happen with the kids, especially because I know you have some kids that come like every session that you do, and maybe you could share a little bit about that.
Yeah, I have a little following, and most of it is actually our kinship families that they love the workshops. They come with their kids, and what I love to see is how the activity brings the families together and that interaction. Because you're talking, like the Gross family, they have teenagers, and they walk in, and one teen walks in, and another teen walks in, and then a little one walks in, and then they walk in, and it's kind of like they're all there at the same time, but they're not really like together. But then they sit down at the table together and they get the materials and they start their project. And all of a sudden, there's that conversation sparks between them, and they're looking at what each other are doing, and they're asking questions about it. And everyone is doing something so different. I mean, I did a little workshop here. The last one that I did this summer was summer wind, and we did these wind catchers, right? The activity was to make a wind catcher. And I had a lady come with two teenage boys, and she was really into the wind catcher thing, man. She had it all done, and she was so into this project. She was like so excited. She was starting on her second one before we were done. And her boys were looking at this going, yeah, not for us. This is not for us. And I always tell them, it doesn't matter what you do. This is your time. This is your window of time. You can use it however you want. You don't want to make a wind catcher? You tell me what materials you want. I will get them for you. You just do whatever you want. And one of them sat there and drew a picture of Darth Vader. And the other one sat there and drew pictures of race cars. And they were really happy to share this artwork at the end of class. It had nothing to do with our theme or our project that I had planned, but they loved it. And they sat there and had a really good time. And then you know how we do the survey afterwards, and I'm thinking, oh, these boys, but they're gonna just, this was boring. Mom never brings this again. This was the worst thing ever. They gave me the nicest reviews. It's like Misty was great. She was so attentive, and this was really fun. I'm so glad we came. We should come more often. And I'm like, wow, wasn't expecting that. So yeah, like I say, I think that the key is really tailoring it to your audience and giving them that permission to do whatever they want with that time and express themselves however they want to, if it's going along with your theme and your decor or not. Okay.
Yes. Oh, beautiful. Thank you, D. Ellen. Yes. We always are all about meeting folks where they're at, and the art always meets us where we're at. And I always like to say the art doesn't judge. And the art is there for us to do allow whatever is in our heart to come on out. And if what's in our heart is Darth Vader and race cars, well then fabulous, fabulous. I love it. And yes, yay, Niobe and Barbara, two more of our beautiful trained facilitators from A Greater Hope. We love y'all. Oh, wonderful. We've got about 2 more minutes left. And so I welcome Niobe and Barbara, if you each want to share just briefly. And as you all are sharing, I welcome for anyone in this space to think about what might you want to carry forward in your heart and mind from our time together. And you could put that all in the chat. We welcome it. Oh, wait, maybe it's 60 seconds. Mine's getting a little jumpy. Yes, go for it. Thank you.
We're counting down here.
I just wanted to say we did one of the Window Between the Worlds activities at one of the staff meetings that we had, and I was going through a lot emotionally with losing my aunt, and it made the difference. So it works. It's really therapeutic. And we did another one at our staff meeting just recently, and like I said, it puts things into perspective, so it works, and you can totally see how you can use it for any team building event or even just at home. I've done it at home with my little cousins, because they just didn't understand the death process. So it's just, it's very beneficial. So if you can put it in your program, incorporate it any way you can, I would say 100% go, because we do it here at Greater Hope and we love it. So definitely do it.
Thank you, Niobe. And so sorry